Good afternoon, and thank you all for coming. I am Tom Keller, President and CEO of Ozarks Medical Center. On behalf of Ozarks Medical Center, I want to welcome Governor Jay Nixon, West Plains Chamber of Commerce Board Member Dr. Josh Cutter, Dr. John McCormick, the OMC Board of Directors. If you could just please stand real quick so we can recognize you if you're here. I know that there are some of you, or raise your hand. The medical staff of Ozarks Medical Center, the employees, and each of you who have joined us. We are here today to discuss a topic that will impact our hospital, and already has, and will impact our community for many years to come: Medicaid expansion. As the region's largest employer, Ozarks Medical Center is working hard to meet both the medical and economic needs of our community. A strong hospital is absolutely a critical component to the success of our community. Because of OMC's high percentage of Medicaid and charity care patients, the organization is greatly impacted by decisions regarding Medicaid reform and eligibility expansion. In 2013, OMC provided a total of $6.5 million in charity care to patients without insurance. In addition, OMC had more than $20 million in bad debt in 2013 from patients who were either unable or unwilling to pay. Many of these patients are the working poor. They live below the federal poverty level, yet do not qualify for Missouri Medicaid. It has been a year of difficult decisions for OMC. In June of 2013, OMC had to eliminate 32 positions, while other positions experienced a decrease in hours worked in each pay period, and others have really gone unfilled. The number of people that still are experiencing a decrease in their hours started back in June, but continues today. So that has not gone away. Our mission at OMC is to provide high-quality, compassionate health care and promote wellness in the communities we serve. However, in order to accomplish this mission, we must invest in new technology, we must have the appropriate staffing and well-qualified caregivers, and we must have the facilities to provide care to our community. As the sole community provider hospital in this area, and as the community's largest employer, it is critical that OMC have the necessary funds to provide the high-quality services this community needs. We appreciate you all being here today and your interest in a topic that has the ability to greatly impact our organization and our community. I'd like to ask Dr. John McCormick, a West Plains primary care physician, to say a few words from a physician's perspective. Dr. McCormick?
Thank you, Mr. Keller, for inviting me to speak today, and thank you, Governor Nixon, for being interested enough to come down and listen to our concerns. I'm a general practice doctor at Burton Creek Rural Clinic. Many of you I've seen before. We're an independent group practice here in town, and we're very concerned about the Medicaid expansion and the ability to provide better care for our patients. I've watched and listened to this debate for years now, it seems like, and I know everyone else here has too. And I've tried to figure out why we wouldn't just go ahead and do this. It made such sense. And I'm torn a little. I look at it from several different perspectives. I look at it from my perspective as a private physician, independent practice. I look at it from my position on the board of trustees at OMC, and also as a medical director for a free clinic, seeing patients that are directly impacted by the presence or absence of this Medicaid expansion. It's from that perspective of the free clinic that I wish to speak most urgently. As an independent physician in this underserved area, that expansion of Medicaid is very important, not just for me and not just for my hospital, but also for my patients, and my patients that are suffering now, not in the future, not in that nebulous future where we're going to have our philosophical differences taken care of. They're suffering now, and they need care now. And I'll understand all too well how the actual existence of our hospital is threatened if we don't have Medicaid expansion under the new federal reimbursement guidelines for hospitals. At our free clinic, and I say our free clinic because most of the general practitioners in West Plains and nurse practitioners donate time there. We see a lot of patients, but we can only see them twice a month. These patients would be, everyone who qualifies to be seen in our clinic would qualify for Medicaid under this new expansion. And it would really please me to be put out of business because then these patients could have more constant, immediate care for chronic medical problems. It's not uncommon for us in the free clinic to see diabetics who haven't had insulin for 2 or 3 weeks because they couldn't afford to buy it. And we only are there every 2 weeks to see patients who've had strokes who need to be on a blood thinner and they've run out of their medicine and they're very much at risk for another stroke. And they do this not because they're negligent for their own health. They do this because they can't afford medical care. They can't afford to get medication. So this is a very real proposition now, not just in the future. I want to mention one example, a patient I saw Monday this week, and this happens all the time. A gentleman who came in who had developed significant problems in the night, shortness of breath, kept him up all night. He's always been healthy. He doesn't have any insurance. He's a carpenter, works regularly, but he can't afford insurance. He can't afford medical care. And he stayed home all through the night because he didn't feel that he could afford even the expense of coming to an urgent care. And he was afraid of what he would find out. And, I could see this guy was a tough guy. He's used to weathering any ills, but he was in serious distress. And as soon as I checked him over, I could see his future. He's going to have to go to the emergency room. He's going to be hospitalized. He's going to have a huge medical bill. He's very concerned, not about his health, but about being able to pay his bill. And you could just see this tough guy just sort of melting, thinking about what was going to happen. I sent him to the emergency room, and he was admitted to the hospital, and the rest of that will play out. This is the kind of person that Medicaid expansion could give some protection to and allow to take care of medical problems before they reach the urgent stage at this age. Thank
you. Thank you, Tom. Thank you, Dr. McCormick. And thank you for everything OMC does to create jobs in this community and keep the working families in this area healthy. Unfortunately, creating jobs and keeping jobs will be incredibly difficult if Missouri fails to move forward on Medicaid expansion. Study after study after study has made it clear that the dollars, the jobs, and the opportunities behind Medicaid expansion are real. State after state after state have moved forward on this issue and are seeing these real benefits every single day. When people in Jefferson City say they don't believe the economic impacts of Medicaid expansion, I would remind them of the old adage that everyone is entitled to their own opinion, but not their own facts. And the facts are clear. Medicaid expansion will create jobs. It will improve health care, and it will strengthen our state's budget. That's why we've been so pleased with Governor Nixon's outstanding leadership on this issue. Governor Nixon understands the human aspect, the need to care for working families and vulnerable Missourians. And he also understands the very real business aspect, that to keep the doors of OMC and rural providers across the state open and people employed, we must keep up with a changing healthcare industry. The governor has been unwavering in his commitment to working across the aisle to find the best solution for Missouri on a number of healthcare issues. And we're honored to have him here today to talk about strengthening and expanding Medicaid in Missouri for the health and economic well-being of our state. Please join me in welcoming Governor Jay Nixon.
Thanks to all that are here today. Dr. McCormick, Dr. Cotter, leaders of the West Plains Chamber, also Tom Keller and the folks at OMC for hosting us. The quality services provided at OMC are a great example of how healthcare is so important to our quality of life and to our economy. From screening moms for breast cancer, to caring for kids with developmental disabilities, to treating grandparents with Alzheimer's. These caregivers work tirelessly to help folks in this community lead healthy, productive lives. OMC is also this region's largest employer, providing good jobs and strengthening this community's economy. As mentioned before, unfortunately, right now, inaction by the Missouri General Assembly is having a real and harmful impact on hospitals and communities just like this one all across our great state. Here's why. Under the Affordable Care Act, federal payments to hospitals and healthcare providers are reduced, but states can make up for those cuts by reforming and expanding Medicaid, the state-federal partnership that provides healthcare to low-income children and their families. In Missouri, expanding Medicaid would provide affordable health coverage to 300,000 additional Missourians, folks who are working but don't have health insurance. Now, there are many reasons why this is important that we move forward with Medicaid this year. Strengthening Medicaid will protect taxpayers from having their tax dollars spent for healthcare in other states. Strengthening Medicaid will create tens of thousands of jobs and inject billions of dollars into our state's economy. Moving forward will also allow us to implement reforms and reduce costs to the state budget, generating more than $90 million in savings and revenue for our budget just this year. Okay? And it will allow hundreds of money we can use in schools and other things. And it will allow hundreds of thousands of working Missourians, folks making no more than $27,000 a year for a family of three, to get the physical and mental health they need to live healthy, productive lives. Without question, strengthening Medicaid is the smart and right thing to do. That's why across the nation, we see governors and legislators of both parties come together to bring their tax dollars home to improve and reform health care in their states. But here in Missouri, so far, we have not gotten that done. And as a result, our tax dollars are now going to other states. They're getting the benefit, we get the bill. Today is an auspicious day. Since January 1st, Missouri taxpayers have now spent $500 million. Okay? That's $5.47 million a day to improve and reform healthcare in states like Arkansas and Arizona, New Jersey and Iowa, Michigan and North Dakota. $2 billion a year, $500 for every Missouri taxpayer. That's right. Since January 1, everyone in this room, the taxes you pay, has sent $500 million to Washington that's being used in other states to improve their health care. We need to spend that money right here in the Show Me State. Now, I'm assuming, since we're coming up on tax time, that nobody here has had the opportunity to stop paying federal taxes. So that means we're still going to have to keep paying them. Okay? And our hospitals are still going to have to keep making those cuts. Now, last week, the Missouri Chamber of Commerce and the Missouri Hospital Association issued a report quantifying the initial impact of the legislature's inaction and what it's meant already on the economy in our communities. And the findings were stark. In the last 6 months alone, hospitals in Missouri have shed 3,000 jobs, including dozens right here in West Plains. The report found that most of the cutbacks to staff and services have occurred in rural areas, okay, where hospitals like this one are vital lifelines for residents who would otherwise have to travel hundreds of miles to get the care that they're required. Folks, these are real people who've lost their jobs, who now don't get paychecks. These are real communities losing access to services. These are real working Missourians who are being denied affordable health coverage for no other reason than they happen to live here in Howell County instead of across the border in Mountain Home, in Cape Girardeau instead of Cairo, Illinois, in Maryville instead of Muscatine, Iowa. That's wrong, and we can fix it. Last year, the opponents of Medicaid expansion said we shouldn't move forward because Congress would repeal or refund this law. That has not happened. Congress passed it, the President signed it, the Supreme Court upheld it, and this year Congress is funding the Affordable Care Act with our tax dollars, unfortunately, in other states. This year, Missourians are suffering the consequences. This year, Missouri taxpayers are paying the price. This year, the costs of inaction are real, and there are no more excuses. We all know that there are problems with the Affordable Care Act, but rejecting Medicaid won't fix any of those problems. It will only make them worse, forcing Missourians to pay all the costs of this law and get none of the benefits. Fortunately, there is a very clear path and plenty of time left in this session of the General Assembly to prevent further harm to our economy and put the needs of Missouri families first. By expanding and reforming Medicaid, we can reverse these harmful job cuts, stop the flow of Missourians' tax dollars to other states, and bring affordable health coverage to hardworking Missouri families. We simply cannot afford to wait. It is time for action. With that, I'll be glad to take any questions. Anybody has any questions?
Governor, in the past, governors have managed to work with legislative bodies across the aisle, all the way from Carnahan to Hancock to Ashcroft. They all got major policy done with the legislator being controlled with an opposite party. Kit Bond, at the time, he had weekly meetings with senators. A lot of these decisions were forged through relationships. So my question today is twofold. In hindsight, what would you have done differently to foster those relationships and kind of nurture them for this particular issue? And secondly, will you apply that hindsight to this issue going forward?
Today is World Autism Day. My first year as governor, I tried to pass autism mandate. We didn't get it done. So we came back the next year and got that done. And today, 1.6 million Missourians are covered by autism coverage, and 3,000 kids today got ABA treatment to turn their lives around. You bet we can do this. I know we got plenty of. So I spend a tremendous amount of time with members of the legislature trying to both listen and understand their positions, and certainly work to expand relationships with members. And First Lady and I have every one of them for dinner each year, and all of the various things. I spent a lot of time yesterday with members. I'll see a number tonight at a forum we're doing. So we spend a lot of time there. Ultimately, I think, though, that we live in a world in which, in a democracy, elected people most likely react to what their constituents feel. I mean, we live in a representative democracy. And while I do spend a tremendous amount of time, what I would have done different, I told somebody after I got elected governor, I took the rear view mirrors off my car and just decided to look through the windshield. I try to stay focused on where we need to go, and history will have plenty of time later on to analyze whatever we've done. But we have made great progress on a lot of things, and I think this is an issue that we stand fully capable of making good progress on. April 1st, around the middle of April this year, late April, you're going to see the first brand new car roll off the $1 billion Ford factory up north of Kansas City. A vehicle that only was made in Europe before is now made in Missouri. Thousands of jobs. Okay, we did that in a special session working across the aisle. We passed the budget each year in a bipartisan way, and we maintained our AAA rating. I think that if the people continue to speak loud on this issue, we'll be able to forge the necessary compromises that are there. Yes, ma'am.
Governor, any of us who have ever tried to push a rock knows it's easier to push a rock that's already a little bit loose around the base. So instead of us pushing on all of these rocks, who do we push at the hardest? Who is a little loose around
One of the ways I try to get along with the legislature is not refer to them as. I'm trying to get better at that sort of stuff. I appreciate what you're saying. I think I have two things. First of all, I think every member of the legislature should hear about this. I don't think this is an issue in which you should say, all right, who are our friends? I think this is something that's going to move. I mean, the House is moving a bill, okay, and last night the Senate debated this, and they came back today and began debating it again. And they went to something else. But that's the first time the Senate has had floor action on this measure in 2 years. That's a good sign. They're talking about it. But I think that the rocks that feel most you're pushing are the ones you live closest to. And I think that elected officials are much more swayed by people they know and people who live in their communities than by polls or outside forces. So I would just recommend if there is a legislator near you that's who I would prioritizing my pushing. Yeah. Yes, sir.
At noon today, the National Public Radio station out of Springfield reported that I believe it was Senator Ryan, Republican senator, that said essentially that I think we can move forward on this if we do certain things, and he described what they were. And the thing that puzzled me is he said, without breaking our budget. My understanding was that the federal government was going to pay 100% of the cost, at least for 2 years, and then indefinitely 90%. So what is this breaking the budget? Is that just political talk?
There's a lot of political talk around this. I mean, quite frankly, there's a whole lot of people saying things that they said in elections 2 years ago and not saying what's the reality of what we're doing today. I mean, that's just a way of the speak here. But Senator Sylvie, who is one of the folks that's pushing this, I mean, one of the arguments back has been in the out years, if you go to 90-10, my gosh, that will cost a lot of money and we won't be able to afford that. Well, our Medicaid program is 60% federal and 40% state right now. Our highway program is 70% federal and 30% state in most of the situations. And quite frankly, under that argument, what really busts the budget is to take your taxpayer dollars right here in Missouri and send them to other states and let them use them. That's the worst budget thing you can possibly do. But in order to make sure that we have a plan that makes up that 10% in the out years, some people are wanting to get a little more specific. And so Senator Sylvie and some other folks are working on that plan that can lay out in specific detail what sources of dollars would be out there to match that. And I think that's a good and constructive process to say, all right, if that's the proof point you need for us to show that, then we'll be glad to engage in that level. And that's what I think Senator Sylvie was trying to say to some of the opponents today, last night today, was that if you think that is the impediment to us doing it, then let's engage in an intellectual process so that we can show you how we can meet that test. All the way back, yes, sir. As you saw from the CEO talking, 32 positions already gone, hours being cut in others. I'm just here to say that this is a very real example of the penalties being paid for not moving forward. You have individuals not having the ability to access health care that they need, working Missourians. But from a business hospital perspective, it's organizations like this that have strived for excellence by making sure that they've invested with their community in good facilities, that as the dollars get lessened because of the Medicare side of this, that they don't have any choice but to constrict the services and the workers there because they have made the long-term investments that they were going to have world-class facilities in a growing community. So, unfortunately, the folks that have had the deepest long-term thoughts, those that want to have world-class facilities and be a regional hub for healthcare, those are the first ones that are suffering challenges because they made those investments. And so you're punishing economically the ones that have had the most foresight to prepare for high-quality healthcare in these relatively rural markets. I mean, you do not have to go to Springfield, Missouri anymore to get great healthcare. There are practitioners right here in West Plains. Okay, you don't have to go over there to get an MRI. You don't have to go over there to get X-rays. You don't have to go over there to get an oncologist. Any of that sort of stuff. This community made a decision, 15, 20 years ago, that they were going to be a hub, and that your university was going to be involved here and making sure you had trained professionals here. All of that. So the point I make there is that that's where the constriction. That's why. So after all that thinking, after all that investment, after all that time, this is a place that's having to cut at a time we have more healthcare needs with an aging population. Have to cut hours. They're not cutting hours because people don't need coverage. They're cutting hours because the economics of it don't make sense. And the only reason that the economics of it have changed is because the legislature's not moved forward on Medicaid expansion. That's the only fundamental shift that we've seen here, and it's going to get worse because as these, if you don't move forward, all of these cuts continue to have repetitively difficult situations arise, and so this is a challenge that will continue to get worse until it's solved. Time for one more, then I got to some. Yes, ma'am.
We spoke with our senator
Well, I do think that as you work from 20% federal poverty level up to 133, that I think most people think that we're going to see an economic model in which, as you move to the upper ranges of that, you will begin to see some copays and some deductibles, just so that you have a ramp. So that right now we have a healthcare system. If you really need healthcare and you're working poor, you know the way you get that right now in Missouri? You quit your job. Okay, that's the only way. You quit your job. So we do not currently in that situation reward work. So what they are trying to do, and while it may be an impediment in some situations, they're trying to, the theory is to build a ramp instead of a cliff, so that you don't just have the same choice at 133% of poverty that you have at 20% now. But once again, if we get in a room, I can hammer that out. Okay, I can but folks that, well, I wasn't in your conversation, and that's not a yes. That's a lot better discussion than it was a year ago. Okay, in which they said, "Oh no, Obama, we're not going to do that Obamacare thing." That's much different. If they get into specifics, then we can negotiate ourselves. Negotiate ourselves in an English teacher up here. We can negotiate a way forward that hopefully will balance that in a way that respects. The other thing that we're looking at is ways to assist employers to help meet some of their matches on some of the insurance pieces there that could actually help in that sense too, so that the employers would have a benefit from the state, so that those gaps would be, since it would be cheaper for them, you can make up differences. But if we can get in a room and get negotiating on that sort of stuff, I'm really good at that. Yeah. Go to a dollar.
Start there.
Start there. Okay.